Alrighty, folks, welcome to another edition of the Healthy Way right here on Love 101, the family station. Today we're looking at dementia. Dementia is not a specific disease, but is rather a general term for the impaired ability to remember, think, or make decisions that interferes with doing everyday activities. Alzheimer's disease is the most common type of dementia. Although dementia mostly affects older adults, it is not a part of normal aging. With us this morning is Dr. Alex Tracey. Hey, Dr. Tracey, how are you?
Hey, good morning. How are you?
Good. And you?
I am fine.
Great. Good to have you. What do you want to add
Right.
to that, Dr. Tracey?
Well, let's say that there's a distinction between the more common terminology that persons may use, which is Alzheimer's. Dementia is the general term,
Mm-hmm.
right? Alzheimer's is just a form of dementia, of
Right.
which we're going to actually go a little bit into.
All right.
But just to state that dementia is a general term in terms of loss of cognitive function,
Mm-hmm.
and Alzheimer's is just one part of the
All
one
right.
type of dementia.
All right. So let's go through. Let's get a little deeper. Yeah.
Right. So usually dementia is characterized, as was said before, with memory loss,
Mm-hmm.
difficulty with memory, as well as you may actually have some level of confusion, right?
Mm-hmm.
The term Alzheimer's or the condition Alzheimer's is the most common cause of dementia, and it's usually occurring in the older age group.
Right.
And what tends to happen is that dementia is not really something that is irreversible in the terms of Alzheimer's. However,
Mm-hmm.
there are cases where you have reversible causes of dementia, whether it be something systemic, meaning another part of the body might actually give it issues, or it be a psychological cause of dementia. You may actually be able to reverse the dementia. As such, not
Mm-hmm.
all cases of dementia you should consider it as Alzheimer's,
Mm-hmm.
because it could be a sign that something is wrong with the individual,
Right.
right? And once you get to a point of correcting the issue, the dementia might actually start.
Mm. And how common is it though?
It's very common,
Right.
especially in the elderly,
Mm.
right? The thing is, you have a case what is called vascular dementia,
Vascular
and this is
dementia.
whereby the blood vessels of the brain get kind of damaged.
Right.
And what will happen is that persons will have a decrease in their cognitive function because there isn't good perfusion to the brain. So in cases of like a previous stroke
Mm-hmm.
or multiple stroke, you may have persons having dementia um, secondary to those conditions.
Mm.
All right. The other thing that we may actually have is a type of dementia called Lewy body dementia.
Mm.
This is where there's some deposit of proteins in the brain,
Right.
right? And like Alzheimer's, the person has progressive loss in their cognitive function, memory loss, and it's associated with the elderly, but it's one of the most common cause of progressive dementia, meaning that it's not just an acute thing; it happens gradually over time.
Right. Now, in the intro, I said, it is not a part of normal aging, but isn't dementia part of normal aging though?
It may not. As you know, you have some persons who are um, of in age and they still have good memory. They still can have a good talk with you,
Mm-hmm.
good conversation. So it's pretty subjective. However, what we do know
Mm-hmm.
is that the incidence of dementia increases with age,
Right.
right? So it's not to say, hey, once you're getting older, you're definitely going to get dementia.
Right, right.
But what we can say is that as you age, the incidence of dementia increase.
Mm-hmm.
But
Right.
go ahead.
Or if you occasionally miss your car keys or you struggle to find a word, but you remember it later, those are not signs, but that's quite normal.
That is okay. However, if it's persistent and if it's getting worse,
Mm-hmm.
right, to the point where it's affecting your daily function, then that is something that you would need to investigate. But a
Right.
one-off instance of forgetting where your keys are,
Right.
no.
Mm-hmm.
But more importantly, is that we have to explore conditions which may lead to dementia,
Mm-hmm.
right? Especially acute cases of dementia, right?
Right.
And how is it that these conditions can actually be reversed to lead to you having better cognitive function? So one of the mis conditions that may lead to dementia is vitamin deficiency,
Mm-hmm.
especially vitamin B12 deficiency, vitamin E as well. But vitamin B12 is a deficiency, is a common cause of
Right.
dementia that may be missed. The vitamin B12 deficiency is very common in persons who are vegan,
Mm-hmm.
who don't consume meat, and are not on any form of vitamin B12 supplementation,
Mm-hmm.
right? Other things that can actually lead to acute cases of dementia, infection, like infection of the brain,
Right.
infection of the meninges, like meningitis, or inflammation, and also the side effects of certain medication may lead to you having
Mm-hmm.
dementia type symptoms.
Mm-hmm.
The worst case scenario is if you have a brain tumor, right? Or something that is causing a compression of the brain or increased pressure inside the brain, then that can also lead to you having a case of uh,
Mm-hmm.
dementia.
Right.
And last but not least, traumatic brain injury.
Mm-hmm.
Traumatic brain injury is also a cause. So if you met in a motor vehicle accident or you had a trauma to the head,
Right.
you may end up with dementia from brain injury.
Mm-hmm. Now, in terms of the diagnosis, how is it diagnosed? How is the
Well,
exam done?
you, you actually can get a clue as it relates to dementia based on the clinical findings, so history and examination. Once we rule out that it's not secondary to a pathology like what I just said,
Mm-hmm.
the list that I just went through, then we may deem it as a possible, like Alzheimer's, or it could be Lewy body dementia. Some of these are what we actually look at, but
Right.
definitively we would want to do a CT scan or MRI of the brain,
Mm-hmm.
right? Then we also actually do a neurological evaluation. So we may check the person's memory, language, and attention span, somewhat almost like mental status examination.
Mm-hmm.
And last but not least, blood tests. So we check thyroid, we check the vitamin B12 levels, check for any other chronic illnesses such as like kidney disease, liver pathology that may lead to cases of dementia.
Mm-hmm. And in terms of treatment, yeah, what are we talking about, Dr. Tracy?
Well, you do have medications that are there dedicated to treating persons who have dementia, Alzheimer's. There are medication that can improve Alzheimer's, as you would see on the TV or on the internet,
Mm-hmm.
right? But there's also therapy. So it's uh, it's a multidisciplinary approach. So yes, medication is there, but you want an occupational therapist, someone who can come in, sit, talk
Mm-hmm.
to the person, modify their behavioral pattern. You also want to limit the risk because these persons are now almost like a second. baby or second child, right?
Right, right.
So you're going to have to modify the way that you have your environment, take away sharp, take away instances of falls, right?
Mm-hmm.
Or sharp edges that may lead to injury if the
Right.
person actually is unstable in terms of their behavior.
Right.
So these are some of the things that you would have to take in consideration
Right.
and somewhat just get them active, more involved
Mm-hmm.
in activities, community activities. These not isolating themselves or being alone, and family support is of great importance as well.
Right. A comment here from one of our listeners. She says, "My mother keep beating herself on the wall and getting very miserable. Sometimes she can't control herself, put it that way. And, she got two strokes.
Mhm.
And now she's asking how do you know when someone developed dementia? But we went through some of those a moment ago.
Right. So as
Right.
we said before, a cause of dementia is a recurrent stroke, right? Whereby there is damage to the brain, so there is um, full function of the brain, the cognitive function of the brain, and it depends on the part of the brain
Mhm.
that is actually affected that will determine your cognitive functioning,
Right.
right? So what I would advise for her is that one, she brings her mother in to get an evaluation,
Mhm.
right? We, she may need to see a neurologist. I'm hoping that she is being followed up with a neurologist,
Mhm.
right? The occupational therapist would also be needed, right? And modification of the whole home environment would be needed in
Mhm.
the case of that person.
Right.
But she would definitely need to be following up with a neurologist
Mhm.
regarding her previous.
Right. Another one. This one says, "Doc, can someone in their 40s have Alzheimer, or can persons have early menopause through dementia?"
Well, I'm thinking that she's trying to say if early menopause could lead to some form of dementia. Well, what I would say is that early menopause is quite common, right? It's hormone mediated, and as such, at times it can get extremely irritable. Um, we don't normally just say, hey, the dementia is secondary to the menopause. We want
Right.
to rule out everything else, especially in a young person. We want to ensure that it's not secondary to an underlying medical condition.
Mhm.
Common ones maybe like the vitamin B12 deficiency that I was telling you, or like a thyroid disease. So these are some of the things that we would want to rule out first, and then we
Mhm.
would want to establish that it would be secondary to our hormonal imbalance.
Right. One second, Alex. Go for gold and win big with First Global Bank when you access an unsecured loan. Spend 25,000 or more using your FGB Visa cards, or open your account with 25,000 or more. The time powered by FGB Go for Gold is 8:45. We're inside the Healthway this morning. We're talking to Dr. Alex Tracy. We're discussing dementia. Um, what does you want to add, Dr. Tracy, as we sort of wrap things up this morning?
Well, just to make it clear once more that dementia and Alzheimer's, right, are actually not, what should I say now, synchronous in terms of terms. They're Alzheimer's is a type of dementia, right? Dementia is a general term
Mhm.
for decrease in terms of your memory or cognitive function. Be aware that though Alzheimer's is the most common cause for dementia, there are way more different causes of dementia. It can be a systemic disease, example, thyroid disease,
Mhm.
vitamin B12, or vitamin deficiencies, right? It could be secondary to something wrong with the brain, right? So, in terms of that, once you're having gradual loss of memory, gradual loss of your cognitive function, it would be very, very important for you to get an evaluation especially in the elderly, don't say, hey, it's definitely Alzheimer's. It
Right.
could just be vitamin B12 deficiency. And once you correct that, the person would go straight back to normal. Could be something in the brain. Once you correct that before it's too late, the person would go straight back to their normal. May not fully, but they may go back to a better state in terms of their mental function.
Right.
So get evaluated if you're having signs of dementia.
Nice. How can we find again Dr. Tracey?
Right. So our offices are located at Shop 128, Greater Portmore Shopping Center. And we're also at 23 Young Street, Spanish Town, beside the Cumberland Pharmacy.
Can I thank you? All the best.
Yeah,
Keep
man,
safe.
you're welcome. Thank you. Bye.
Great. That's our friend Dr. Alex Tracey. Yeah, dementia. Yeah, our discussion today. This is Love 101, and it is the family station. Come back next time, no? For another in the series, The Healthy Way. Please stay with us.